Sorry, but this will also be about journalism. I call this a view from the trenches. When the AIDS epidemic struck in the early 1980s, newspapers and other media outlets across the country, and possibly the world, were faced with a dilemma of how to cover it. Was AIDS a medical story that required the insight of a reporter who knew medical terminology and basic research? Or was it a political story, since the disease also was raising all kinds of issues related to civil rights, discrimination, and fairness? In America, journalism, diseases aren't supposed to be this complicated, but AIDS was something new and even scary, and it had to be assigned to a reporter with the ability to find a wide variety of stories, not just talk to doctors and researchers. That said, I really thought I was the wrong person to cover AIDS when my city editor at the Morning News asked me to do it in 1987. I've been covering Dallas City Hall for almost 2 years, and I did not have a science or medical background. I told him I didn't know enough about AIDS, and I had no idea where to start. Well, the editor made me do it anyway. He said whatever medical stuff I needed to know I could learn, and the story was so much bigger than that anyway, and he was right. From 1987 to 1990, I was the paper's full-time AIDS reporter, and I wrote a couple hundred stories that ranged from technical reports from international AIDS meetings to bedside confessions from people dying from AIDS. The paper sent me to Stockholm, Montreal, and several times to San Francisco to write about AIDS. It turned into the greatest challenge I would tackle as a reporter, and I would say in 40 years, and one of the most heartbreaking things I would ever do. I'd been a reporter for 14 years at that point, and yet nothing prepared me for the journey I took on this beat. I have compared it to covering a war in which practically every person I interviewed was going to die. This was not a subject you could cover from afar like you can some beats. I was down in the trenches where people were fighting for their lives and dying almost before my eyes. It was my job to make that fight so real that people might care enough to respond. But it also was a time when sick people were being blamed for their disease, and when the government thought it could ignore what was happening because most Americans didn't seem to care. My first struggle was to attach real names to real stories, which was no small problem in the 1980s. These people were afraid to be identified as being gay and having a dreaded disease. They worried, even as they were dying, that their families wouldn't want other people to know the cause of death. Without a name, readers wonder if you've embellished the story or even made it up. And how do you make anyone care if the victim is hiding behind a fake name? Even more troubling, how do you ask someone who is dying to be brave enough to put their name out in the world? But I begged and I begged until finally I got real names of real people, and then I was hit with a tidal wave of stories. It turned out that people with AIDS wanted very much to talk about the disease, how the disease had driven them to the point of suicide, how they were shunned by their own families and former coworkers, how they lost their job and their health insurance, but not their hope, how they couldn't believe such a thing would happen in the United States of America, the greatest country in the world, yet no one seemed to care. For nearly 3 years, I captured their words and put them in print. Occasionally, I would escape the heartbreak by covering the blue ribbon panels and the legislative committees that were studying AIDS but not doing very much. There were battles over whether or not a doctor had to disclose to his patients if he was HIV positive. They decided he didn't. Or whether realtors had to reveal to home buyers when a home had been owned by someone with AIDS. I don't remember the outcome of that one. Okay, there was HIV testing by hospitals and insurance companies without a patient's consent. There was endless fighting over scarce dollars for social services for AIDS patients. Of course, I covered the demonstrations and the growing anger against the government as it failed to react. I traveled to Washington several times for mass protests and hearings. Dallas had its own protests, of course, but they did not go over that well in a city that does not embrace public dissent. Sure, people were dying, but couldn't you just be a little less noisy about it? I'm not certain when attitudes started to shift and private donations started to trickle in Dallas. Maybe the endless stories about hardship and death finally got through. Maybe it was the fact that wealthy families were not immune to losing someone to AIDS, although they did not acknowledge the cause of death. By 1990, people were calling the lack of response to the disease a Holocaust. And indeed, there were 115,000 Americans at that point with AIDS, and the numbers were just climbing. Bill Hunt, who was vice president of the Gay Alliance then, put it best, quote, "After 8 long years of battling this disease, nobody really cares that we're still dying," he said. By then, I was wondering how much longer I could handle it personally. Early on, I had decided I would not attend the funerals of all the people I had interviewed because I knew I could not tolerate that much grief. I'm the kind of reporter who cries during interviews whenever my subject cries, but I keep taking notes too. Finally, there was a point when people who knew me started wondering if I'd crossed some imaginary line reporters aren't supposed to cross that threatens their objectivity. To them, I was sounding more like an advocate for AIDS patients than a reporter. I was carrying all those stories around with me, all those deaths, and I really did reach a point where I was having trouble sleeping. I was so distraught that my husband was questioning whether I should do something else. So I went to my editors and explained how hard this had become, and they assured me I just needed some counseling, which they would be happy to pay for. My response was, well, will that make them stop dying? But my bosses were firm. The paper had invested too much to allow me to stop covering AIDS, and they encouraged me to keep working. So I did the only thing that I could do. I quit my job and I walked away.